Have you ever had a cough that just wouldn't go away? Maybe you told yourself it's just a cold. Weeks passed and the cough stayed. You started feeling more tired, short of breath, but again you thought maybe it's just age catching up. If that sounds familiar, then this video might be the most important one you watch today. Lung cancer is one of the most dangerous cancers, but the truth is, it often gives us early warning signs. The challenge is they're easy to miss, or worse, easy to ignore. So today, I want to gently walk you through 6 early signs of lung cancer that everyone should know. 1. A persistent cough that doesn't go away. You cough once or twice a day, then it becomes 5, then 10. Before you know it, you're coughing more often than not, especially at night or in the morning. At first, you think it's allergies or the weather or maybe that old habit of smoking from years ago. But when a cough lasts for more than 3 weeks and doesn't improve, it's time to pay attention. This type of chronic cough is one of the earliest signs of lung cancer. Why? Because tumors growing in the lungs can irritate the airways, causing your body to react by coughing, trying to clear out what it thinks is an invader. Tip: record how often you're coughing. If it's waking you up at night or causing chest tightness, talk to your doctor. 2. Chest pain that gets worse with deep breathing or coughing. Not all chest pain feels like a heart attack. With lung cancer, the pain might feel dull or sharp, sometimes in the front, other times it travels to the back or shoulders. You notice it more when you breathe in deeply, laugh, or cough. That's because the tumor may be pressing on the pleura, the thin lining around your lungs, or even on nerves or ribs nearby. What's tricky is that people often dismiss it. They say, oh, I just slept wrong, or maybe I pulled a muscle. But if it's there for days or weeks, it's time to get it checked. Tip: if your chest pain is new and consistent, especially when breathing, don't ignore it, even if it's mild. 3. Shortness of breath. Doing everyday things. It starts slowly. You climb stairs a little slower than before. Then walking from the living room to the kitchen leaves you slightly winded. You might think, I'm just out of shape, or maybe I'm getting older. But lung cancer can block or narrow airways, reduce lung capacity, or cause fluid to build up around the lungs, all of which make it harder for you to breathe, even during simple tasks. This shortness of breath often creeps in quietly, but once it's noticeable, it's serious. Tip: compare your breathlessness today to how you felt 3 to 6 months ago. If there's a change, get evaluated. 4. A hoarse voice or voice that changes over time. You answer the phone and someone says, "Are you sick?" But you feel fine. Uh, your voice is raspier, deeper, or sounds strained, like you're always trying to clear your throat. If this lasts more than 2 to 3 weeks, it's worth checking out. Why? The nerves that control your vocal cords run near the lungs. If a tumor presses on these nerves, it can affect how your vocal cords move, changing your voice. Sometimes it's one of the first signs of something going wrong, and many people overlook it. Tip: if your voice is hoarse and you're not sick, or if your throat always feels tight, ask your doctor for a laryngoscopy and chest imaging. 5. Unexplained weight loss. You step on the scale and you're 10 pounds lighter, but your clothes still fit the same, and you haven't changed your eating habits. This kind of sudden, unexplained weight loss isn't just a mystery, it's a warning sign. Cancer changes how your body uses energy. It speeds up metabolism and releases substances that make you lose weight, even when you're eating normally. For many people, this is one of the most visible but least understood signs of internal illness. Tip: track your weight monthly. If you've lost more than 5% of your body weight in under 2 months, talk to your doctor, even if you feel fine. 6. Coughing up blood, even just a little bit. You cough into a tissue and there's a red streak. Maybe it's just once and you try to forget it, but a week later it happens again. A bit of blood in your saliva or mucus. Even a tiny amount of blood is a red flag when it comes from the lungs. It could be caused by a tumor damaging small blood vessels in the airways. Sometimes people think it's from the throat or gums, or they chalk it up to dry air. But it's always better to rule out serious causes first. Tip: if you see any blood when you cough, take a photo or keep the tissue and show it to your doctor. Don't wait for it to happen again. If you or someone you love is experiencing any of these signs, please don't wait. Getting checked early can make all the difference. Remember, listening to your body is not fear, it's wisdom. and taking care of yourself is one of the most powerful ways to show love to those around you. If you found this video helpful, share it with a friend or a family member. You never know, it might help someone get checked just in time. And if you'd like more gentle, easy to understand videos on health and wellness, don't forget to subscribe. I'm here every week just talking like old friends about the things that matter most.